Today we're diving into an important topic that affects many lives: cancer. Specifically, we're going to focus on a type of cancer that affects the blood and bone marrow, leukemia. This video aims to provide you with a clear understanding of what leukemia is, its types, symptoms, causes, diagnosis, and treatment options. So, let's start by understanding what blood cells are and what they do. Your blood cells are like tiny workers that help keep your body healthy. They carry oxygen, fight off infections, and help you heal from injuries. Leukemia is a type of cancer that affects the blood and bone marrow. It occurs when the body produces an excessive number of abnormal white blood cells, which can interfere with the body's ability to fight infections and perform other vital functions. Or leukemia occurs when there's a problem with the way the blood cells develop and grow in the bone marrow. Instead of creating healthy, functioning blood cells, the bone marrow produces abnormal cells that can't do their job properly. Leukemia can occur at any age, most often in adults older than 55. However, it is also the most common cancer in children younger than 15. When it comes to types of leukemia, there are several types, each with its own unique characteristics. Acute lymphoblastic leukemia is the most common type, especially in children. Chronic lymphocytic leukemia is more common in adults, and chronic myeloid leukemia is another type that affects both children and adults. Symptoms of leukemia can vary but often include fatigue and weakness, frequent infections, unexplained weight loss, swollen lymph nodes, easy bruising or bleeding, and pain in bones or joints. If you or someone you know is experiencing these symptoms, it's important to consult a healthcare professional. But when it comes to the signs and symptoms of leukemia in children, parents and caregivers should be aware of 1. Persistent tiredness that doesn't improve with rest. 2. Increased susceptibility to infections due to a weakened immune system. 3. Easy bruising, frequent nosebleeds, or bleeding gums can be warning signs in children. 4. A noticeable paleness or a lack of color in the skin can indicate anemia. 5. Enlarged lymph nodes in the neck, armpits, or groin that may feel firm or tender. 6. Complaints of pain in the bones or joints, which may be mistaken for growing pains. 7. Unexplained weight loss or a lack of appetite. And lastly, persistent fever or excessive sweating in children during the night. The exact cause of leukemia is not fully understood, but several risk factors have been identified, including genetic predispositions, exposure to radiation or certain chemicals, previous chemotherapy or radiation therapy for other cancers, and certain genetic disorders, such as Down syndrome. When it comes to diagnosing leukemia, it typically involves a combination of 1. Blood tests to check for abnormal levels of white blood cells. 2. Bone marrow biopsies to examine the marrow for cancerous cells. And 3. Imaging tests, such as X-rays or CT scans, to assess the extent of the disease. Treatment for leukemia varies based on the type and stage of the disease. Common treatment options include chemotherapy, which is the primary treatment for most types of leukemia. That is, using drugs to kill cancer cells. Radiation therapy target cancer cells with high-energy rays. Stem cell transplant, that is, replacing damaged bone marrow with healthy stem cells. And targeted therapy, using drugs that specifically target cancer cell mechanisms. To wrap up, living with leukemia can be challenging, but support is available. Many patients benefit from joining support groups, where they can share experiences and coping strategies. Maintaining a healthy lifestyle can also help manage symptoms and improve overall well-being. Thank you for watching our video on leukemia. If you found this information helpful, please like, share, and subscribe for more health-related content. Remember, early detection and treatment are key. Stay safe and take care of your health.